In this video, we're going to be doing Invisalign open bite correction. This time it's a 14-year-old female. She had a 3mm open bite, and I'll show you how I corrected it. So here we go. Hey guys, this is Dr. Robert Passamano. I'm a board certified orthodontist. Today we're going to be talking about this specific Invisalign open bite closure for a 14-year-old female. We have a 3mm anterior open bite. You can see in this patient there is tongue thrusting in this photo. You can see her tongue is filling in that area. Tongue thrusting is when you swallow, your tongue has to get pushed forward to create that negative seal. So therefore that's called tongue thrusting because it fills in that area of the open bite. And so our goal is to close that open bite. Let's talk about why open bites even happen in the first place. Sometimes it's from a pacifier or thumb sucking. Sometimes it's from tonsils and adenoids being enlarged, which causes nasal blockage and mouth breathing. When you are a mouth breather, you also have a narrow maxilla because the tongue is a little bit lower. You're not sleeping with your mouth closed. Tongue ties can also cause open bites because the tongue is a lower position. This results in tongue thrusting because something has to fill in that negative area, and that's the tongue. Speech issues, S's and T's, and also eating issues. You can't bite certain foods. And the treatment for this has historically been extraction of teeth. When you take out teeth, you close the angle, and therefore you can close the open bite. We don't do that much anymore because Invisalign has been a great corrector for this specific issue. Jaw surgery in the past has also been used, and nowadays we're doing the new method, which is the Invisalign method. This is great. I love it. I've showed you many examples of it, and this patient also got a great result from the Invisalign. In my previous Invisalign videos, I've showed you a 6mm open bite correction in this 53-year-old. I've showed you a complete open bite correction for a 48-year-old. I've showed you a lateral open bite correction in a 20-year-old. And then I've also showed you an anterior open bite correction in an 8-year-old. And today we have our 14-year-old open bite patient that's 3mm open bite. And what is the cause of the open bite? In a lot of these, it has been narrow maxilla. And in this case, it is going to be the exact same thing. And so the posterior maxilla looks wide to me. I don't see any issues here. It's going to be the anterior maxilla. It kind of forms like a V shape. It's not wide. It's not the shape of the tongue. It's not the shape of the lower arch. You can see that this is not as broad as it could be. And so if we broaden this area out, then we should get more space for the tongue to go into, and then therefore the open bite will close along with the Invisalign movements designed to close the open bite. This is the actual before and after of this Invisalign open bite closure. You can see from the upper, the right side final position is broader and wider. The left side initial position is more of that V shape and more narrow in the anterior. The posterior teeth, relatively the same, maybe a little bit wider, but for the most part, most of the broadening and the expansion of the arch is going to be in the anterior, and that's how we close the anterior open bite. I'll show you from this view over here. Widen, and then we bring them down together. And this usually stays very stable once we close the anterior open bite. I usually like to finish these with a clear retainer versus what we call a traditional retainer. The clear retainers do hold vertical a little bit better. So clear retainers are the preferred option for this patient. Let's do a treatment recap for this Invisalign anterior open bite patient. She is 14 years old. She has a 3mm anterior open bite for the incisor area. This patient has a narrow maxilla in the anterior area, as well as tongue thrusting. You can see the tongue being thrusted forward in this photo. We close the anterior open bite, broaden the anterior area with some expansion and widening. You can see how the anterior open bite is closed. We did a 5mm open bite correction. So that's 3mm that you see that's open, plus an additional 2mm of vertical overlap. So that's 5mm. You can see on the right side photo that the lower image is the after. It's wider. The front image on the top is a little bit more narrow. So this is a great case. I'm very proud of this case. It took 22 months. Sometimes I get these done a little bit quicker. I think with this patient's compliance, it wasn't always there, but we got a great result, and she's happy. She's done with treatment, and now she doesn't have lisping issues, swallowing issues, and speaking issues. So this is a great Invisalign open bite treatment. Thank you guys for watching the Invisalign open bite closure video. Invisalign is my go-to for open bites in general. I think it's great what Invisalign can do at any age to correct these open bites. People suffer for a long time with speaking issues and swallowing issues and tongue thrusting, and this is a great way to close up the open bites. If you guys like this video, don't forget to like and subscribe. Comment down below if you guys have a question, and I'll see you on the next video.